if you have been here for a little while, you know that microneedling is a modality I love. I have microneedled for about 15 years now, and it has literally changed my skin. Now, while I have made quite a few videos on microneedling, it is still the subject I get asked the most questions about. So in today's video, I'm going to try to answer your most frequently asked microneedling questions. This video might be a bit long, so I will leave timestamps down below in the info box. And if you want to, you can just jump ahead to your question. Now, I was going to film this video while doing my own monthly medical microneedling session. However, we are currently staying in Dayton, Ohio. Excuse the strange background. We are staying at an extended stay hotel here in Dayton, Ohio, and it is freezing outside. This is the coldest climate I have ever lived in, and my skin is definitely not used to it and is a bit sensitized. So I decided, even though my calendar is saying that it is time for my monthly microneedling session, I decided to wait a bit until the weather warms up to not further sensitize my skin. But that actually brings me to my first sort of group of questions. The most recent question out of that group was, can I medical microneedle when I have a cold sore? Now, first of all, this is when I give you my disclaimer. I am not a microneedling expert. I'm just sharing with you what has worked for me and also what I have learned in my 15 years of microneedling at home. But if you are interested in microneedling, whether that is medical or cosmetic microneedling, and we will talk about the differences in a second. If you are interested in microneedling, please do your own research. Like I said, I'm just sharing with you what works for me and what I have learned in the past 15 years of doing my own microneedling. But again, the question was, can I medical microneedle when I have a cold sore? Or I've also gotten questions, can I medical microneedle when I'm sick? And so on. In my own humble opinion, well, first of all, let's talk about medical microneedling. Medical microneedling is also known as collagen induction therapy. When we medical microneedle, we use a needle length of 0.5 millimeters or longer. At 0.5 millimeters or longer, we pierce with those needles the stratum corneum, which is the very outer layer of our skin. We enter through the epidermis into the dermis. In the dermis, we find collagen and elastin fibers, as well as fibroblasts. So again, our 0.5 millimeter or longer needles enter into the dermis. In the dermis, we create a bit of damage. We create a controlled injury. The body, of course, responds to this controlled injury and gets to work healing it. It goes through a cascade of reactions, which eventually lead to more collagen and elastin production. Now, this might seem dramatic or scary, but it's actually not unlike building muscle. Let's say I want to get a stronger bicep. I have to lift a weight heavy enough to actually challenge my muscle. While lifting this heavy weight, I create microscopic tears in my muscle fibers. The body then, when I'm at rest, heals those microscopic tears and my muscle grows back stronger. However, one of the stages of healing, whether that is lifting weights or medical microneedling, is inflammation. Now, this inflammation is needed. It is part of the healing process. But in my own humble opinion, if my body is already struggling with something, whether that is as simple as it's freezing cold outside and my skin is sensitized, or I'm fighting off a virus and I have a cold sore, or anything else my body is struggling with at the moment, then in my own opinion, I don't want to add insult to injury. I want my body to heal what it is dealing with, and once I'm healed, once my body is healed, then I can do my medical microneedling session. Now I could cosmetic needle, and we will talk about cosmetic needling in a little while. Let's, for this portion of the video, stay with medical microneedling. But again, in my own humble opinion, I would not medical microneedle if my body is already struggling with something. I would let my body heal and then do my medical microneedling. I hope that makes sense. Now, on that note, I got an email recently from a viewer who had done her first medical microneedling session, and she sent me some pictures of her skin. I believe it was about 5 days after that session, and her skin was really, really irritated looking. And of course, I asked her all the necessary questions. Was her skin clean? What needle length and what cartridge did she use? What did she use before, during, and after her session? And according to her, she did everything correctly. Then I asked her, did she have an autoimmune disease? And she told me that she had not one, but 2 autoimmune diseases she thought were under control. And of course, I don't know for sure. But my guess is because she has these 2 autoimmune diseases, her body was a bit too good at responding to this controlled injury and created all this inflammation. So if one has an autoimmune disease, I would for sure run it by my doctor first, or my esthetician, or anybody who would know, to make sure that it is okay to medical microneedle with this autoimmune disease. Now, talking about what to use before, during, and after. That is probably the most frequently asked question I get on medical microneedling. And like I said, I have made a ton of videos on medical as well as cosmetic needling, and I will link all of those videos down below. And in those videos, I have covered this subject. But I understand it can be quite confusing, and of course not everyone has seen those videos. So right now, let's stay with medical microneedling. In medical microneedling, again, we use a needle length of 0.5 millimeters or longer. Those needles enter into the dermis. Because these needles enter into the dermis, we have to be very careful about what we use before, during, and even after medical microneedling. Now, I just recently, about a year and a half ago, started using a stamping technique. Before I used the stamping technique, I was doing tiny little circles. When I was doing tiny little circles, I needed something for slip, so I wouldn't just scratch my skin. So if one does tiny little circles, we do need something for slip. And that is, of course, if we use a microneedling device like the Doctor pen. If we use a stamp or a derma roller, we don't need anything for slip. But if we use a microneedling device like the Doctor pen and we do tiny little circles, then we need something for slip. So for that, you can use high molecular weight hyaluronic acid. And we want it to be high molecular weight because high molecular weight hyaluronic acid is anti-inflammatory, whereas low molecular weight tends to be pro-inflammatory. So we can use high molecular weight hyaluronic acid. And I don't have the one I used to use with me because I now use a stamping technique, but I will link it down below in the info box. If you cannot find high molecular weight hyaluronic acid, you could use sterile water. Now, it won't give you that much slip, so you would have to reapply, but it is something that could be used. Or there are now so many products that can be used for medical microneedling, and I have 2 of them right here. So this one is a product, comes in 2 different vials, and you mix them up, and it contains a bunch of growth factors and peptides, including copper peptides. And then I have another one right here, and I don't even remember what this one is called, but this one is also a peptide product, and I'm just going to leave it in here. It's also a peptide product. It comes with 2 vials as well, this product, and you mix them together, and then you can apply it, and you can use that for slip. Not only can you use something like this for slip, but you are actually needling these growth factors and peptides deeper into the skin, giving you further benefits. I have tried quite a few of these products. In fact, for my last session, I used a really amazing one, and I can't remember the name now. I will put a picture of it right here. It was expensive, but it lasted me for 2 sessions and it was amazing. But I get all of these products on Lux Lip Lab. They have an amazing variety of products you can use for medical and or cosmetic needling, and also for mesotherapy. So for the most part, if something can be used for mesotherapy, meaning it can be injected under the skin, then of course it can also be used for medical microneedling. So if you're not sure if something is used for medical microneedling, if it is used for mesotherapy, for the most part, you can medical microneedle it into the skin. So if you need slip, if you use a device like the Doctor Pen, if you're doing tiny little circles, high molecular weight hyaluronic acid, sterile water, or a product that can be used for medical microneedling or mesotherapy. If you do the stamping technique like I do now, you don't need anything for slip. You can just do it on clean skin. It is very, very important when we medical microneedle that the skin is really clean. Some people like to use alcohol before they medical microneedle on their skin. I don't like to do that. My skin does not like alcohol. But I triple cleanse my skin and really make sure that it is squeaky clean. And then I medical microneedle. So when you do the stamping technique, you don't need any slip. You could just do it on very clean skin. But what I like to do is I like to take advantage of these kind of products and medical microneedle them into my skin to further help with collagen production. Now, after medical microneedling, so again, our 0.5 millimeter or longer needles go into the dermis. They create a bit of damage there, but they also create open channels. So anything you put on after medical microneedling has the potential, depending on how long these channels stay open, to slip further into the skin, into the dermis, than we want it to. So we have to be very, very careful about what we use, not just before and during, but also after medical microneedling. And I get questions all the time. The last one I got was, can I use Nivea cream after medical microneedling? And I understand why you would want to use that, because when we medical microneedle, we experience transepidermal water loss, meaning our skin gets really dry and sort of like sandpaper feeling for a few days. So putting on Nivea cream sounds really lovely, right? But we don't want this Nivea cream to penetrate into the dermis. Really, the safest thing is to, again, just use high molecular weight hyaluronic acid, sterile water, or, again, products that can be used for medical microneedling or mesotherapy, or some post-procedure products. I forgot to bring it, let me get it real fast. I actually just recently purchased this right here. This is the Alastin, and it is the Regenerating Skin Nectar. And this is a post-procedure serum, and it is gorgeous. And I have used this now twice after 2 medical microneedling sessions, and I absolutely love it. And I have to say, it does help me heal faster. So this is a serum that is quite, that's the word I'm looking for. It does have some dimethicone in it, I believe. So it does have that sort of silicone feel to it, but it feels lovely when your skin is a bit irritated and raw. So you can use something like that. It doesn't have to be this particular serum. Something that can be used post-procedure, meaning after a laser, after skin abrasion, or after medical microneedling. So I hope that helps. I also get asked quite frequently, how often can I medical microneedle? Since our body has to respond to this controlled injury, and again goes through this cascade of reactions, right? One of the healing stages being inflammation, it takes a while for the body to heal. And it also takes a while to produce collagen. So therefore, medical microneedling should not be done more frequently than every 4 to 6 weeks. I like to do it every 4 weeks. Ideally, it doesn't always work out that way. It will be this time be more than like 6 weeks. What I personally do is I write it in my calendar. I write down my last session, and then I make sure, because sometimes time just seems a bit elusive, I make sure to not go earlier than those 4 weeks. So I can go later, that's okay. My body gets a bit extra time to heal, but I don't want to go after 3 weeks again. So I always write it down, make sure that I don't go more frequently than every 4 to 6 weeks. Okay, another question I get quite frequently is, what numbing cream do I personally use? And I don't use numbing cream. I have a quite high pain tolerance, and I don't find this to be, well, it's a bit uncomfortable, but I don't find it to be too painful. So personally, I have never used numbing cream. However, there is nothing wrong with using numbing cream, but I would suggest, if you use numbing cream, to wash it off really, really well before you do your medical microneedling, because we don't want to microneedle the numbing cream into the skin. But since I've never used any, I don't have any to recommend. I know Amazon sells different numbing creams, and if any of you have used a numbing cream you really like, please leave it down below. The next question is, do I need to stop my retin A before microneedling? And if so, for how long? Personally, again, please remember, I'm just sharing with you what I personally do. Personally, I do not stop my retin A before microneedling. So let's say I microneedle today is Thursday, I would still use my retin A Wednesday night. However, I then stop my retin A for up to 5 days after my medical microneedling session, depending on how deep I went. So personally, I do not stop my retin A before, but I don't use it for about 5 days afterwards. The next question is, how do I personally combine medical microneedling with other treatments such as TCA peels? And that is a great question. I have not done real TCA peels. I have done buffered TCA peels, and I actually made a couple videos on those. And buffered TCA peels are much milder. They don't cause a lot of or hardly any downtime. So when I use those sort of TCA peels, what I will usually do is I will do a series of them with about 7 to 10 days in between, and I will just finish up that series and not medical microneedle during that series. So let's say I do 4 of these buffered TCA peels 10 days apart. I will go 40 days, just do those 4 peels, and then wait at least 1 more week before I medical microneedle again. That's how I personally do it. But I would love to know from you, if you do TCA peels and you also medical microneedle, how do you fit it into your schedule? The next question is, how deep should I go? And again, I'm just sharing with you what I personally do. Now, in the past, to be honest, 15 years ago, when I first started medical microneedling, I went way too deep. I always have this mindset, if a little is good, more is better. And I've learned the hard way that that is not true. So now I don't go nearly as deep as I used to. There are many times I just go 0.5 millimeters. Again, at 0.5 millimeters, we are already in the dermis where we find collagen and elastin fibers. So we don't have to go 3 millimeters because we're already there where we want to be. So many times now I just go 0.5 millimeters. I might go 1 millimeter on places where I maybe have a scar, like right here I have some scars, and here as well, or where I feel I'm sunken in and it's a bit harder to get to. So I would say I go between 0.5 and 1 millimeter for the most part, but I can't tell you how deep to go. I would say less is more. So again, at 0.5 millimeters, we are already in the dermis. We don't have to go crazy and go super deep. The next question is, will this help with acne scars? Personally, I don't have acne scars, but I have had scars on my face. I actually fell off my bike a long time ago, 30 years ago, and I had my whole face open. And I had a scar, it went from about here all the way to here, and it was the kind of scar where the melanin was missing. So it wasn't a raised scar, but if I got the slightest bit of sunshine, I would get a tan, and then this part would stay white. And back then I went to several different doctors, and they all told me this is never going to heal. You need skin grafts. You can't see it anymore. Medical microneedling has done wonders for it. It is completely gone. Then also about 10 years ago, I knocked my chin open with my bike lock and I needed stitches. I think I had 7 stitches. And that too, you cannot see it anymore because medical microneedling, it was a scar, you could see it before, but I have medical microneedled it so many times that it's gone. So it can definitely help with scars. And I have heard and read that it can help with acne scars. I can't promise it will erase them, but I do definitely think it will help. And then also I get asked quite frequently, will this help with jowls? I wish. Jowls are complicated, right? Because so medical microneedling does help induce collagen. And one of the reasons we get jowls is because of loss of collagen. But there are other reasons why we get jowls. One is, of course, gravity. And the other one is that we lose bone as we age. So while medical microneedling will address the collagen part, it won't address the gravity nor the bone loss part. I have these thingies hanging right here. And to be honest, I haven't really found that microneedling helps with that. Because again, a lot of it is just gravity. What helps is doing this, pulling it up. But that's a whole nother subject. And then the next question is, can I do this on other parts of my body? And yes, you can. You could technically microneedle on just about any part of your body. Personally, I don't. I microneedle my scalp, my face, my neck, and my chest. But that's it, for 2 reasons. While I would like to see some improvement on my arms, I don't microneedle my arms because it is so time intensive. And secondly, was I to microneedle, let's say, my arms, I would probably do one arm at a time because that is quite a big surface. So not only does it take a lot of time, but doing both arms, in my opinion, at the same time, if I was to do my arms, I think is asking my body to heal a lot of damage at once. So personally, if I, let's say, would microneedle my arms, I would do one arm at a time. I do have a friend who microneedles her whole body. She has gorgeous skin, but personally I don't because it takes so much time. And again, I do think it's a lot to ask of the body to heal all that injury. So was I to do my whole body, I would definitely do one part at a time. But yes, you can definitely microneedle other parts of the body. Like I said, I do my scalp. And I have heard some women microneedle their stomach for stretch marks. So yes, you can medical microneedle other parts of your body. As I'm editing this video, I can definitely notice a difference between the skin on my face and my neck and my chest. And of course, it's not the first time I have noticed that, but I wanted to come on here and address it. Because I know somebody is going to say, if microneedling is so great, why does your neck look so crappy? As I mentioned earlier, I have medical microneedled for about 15 years now. However, unfortunately, for the first, I would say 13 years, I only microneedled my face and completely neglected my neck and my chest. Also, when I finally started wearing sunscreen, which was in my late 30s, I only applied it to my face, not my neck and my chest. So just for the last couple of years, I started microneedling my neck and my chest and also started applying sunscreen on my neck and my chest. So that is why there is such a difference between the skin on my face and my neck and my chest. Would I have microneedled my neck and my chest for the full 15 years, I'm sure my neck would look a lot better and my chest would look a lot better. And also would I have applied sunscreen. So like I said, I just wanted to come on really quickly and address that because I know somebody's going to say something. Along those lines, can I do this on my lips? Personally, I have not medical microneedled my lips. I have cosmetic needled them. But personally, I wouldn't go that deep on my lips. The skin on the lips is very thin. So personally, I have cosmetic needled my lips, but not medical microneedled. And then the next question is, do I always have to use a fresh cartridge? I forgot to bring cartridges in. Hold on, I'll be right back. Sorry, I do feel a bit discombobulated in this different setting. So the question was, do I always have to use a fresh cartridge? Personally, I do, for two reasons. So this is a cartridge right here. They come individually packed and they are sterile. So I always use a fresh cartridge because I want to make sure that my cartridge is sterile, because again, it is entering into the dermis. I also want to make sure that my needles are nice and sharp. So personally, I always use a fresh cartridge. It's not that much waste. So again, personally, I always use a fresh cartridge. And then the next question is, which cartridge should I use for medical microneedling? So for medical microneedling, we want the needles to penetrate deeply. So therefore, we want to use a cartridge with less needles. So think about if you step on one nail, right, with bare feet, that nail is going to go straight into your foot. If you step on a bed of nails, those nails are not going to penetrate. Since in medical microneedling, we want those needles to penetrate, less needles will penetrate deeper. So different doctor pens come with different cartridges, and we will talk about the doctor pens in a second, but they come with different cartridges. I brought my new M8S, and the M8S comes with 18 pin cartridges, which is what I used for my last medical microneedling session. So for medical microneedling, again, it depends on the device you use or the doctor pen you use. Usually you can have 12 pin, 16 pin, this one now has 18 pin, 36 pin and 42 pin. So the 12, 16 or 18 would be for medical microneedling, and the 36 or 42 would be for cosmetic needling, because we don't want them to penetrate that deeply. But let's finish up medical microneedling. One question I get quite frequently, in the past, a couple of years ago, I used a microneedling device called the Derminator, and I have made some videos using that device. Now the Derminator, if you have it, it's a great device, and don't throw it out. The reason I no longer use it is that the company practices strange business practices. Let's leave it at that. And I don't want to support a company that treats their customers that way. So while I still have the device, I no longer use it. About a year and a half ago, I did some research into doctor pens, and I found a company that sells legit or authentic doctor pens. And by the way, you will find websites that say only authorized dealer. There is no such thing. All of these devices are made in China. Companies buy them and sell them. There are fake devices out there, and you have to make sure that your device is not fake. So when you buy a doctor pen, no matter where you buy it from, on the box, it should have a sticker. You scratch the sticker, and then a number will show up, and you will give that number into a website. I will link the website down below. And the website will let you know whether you have an authentic pen. But there is no authorized dealer for doctor pens. Amazon sells them, many different sites sell them. Some sell fake ones. But the site I found, and I talked to quite a few people at their company, and I have somebody that is very responsive and always writes me right back, they do sell authentic doctor pens. So about a year and a half ago, I did some research. I tried my first doctor pen, and I really liked it, and that is what I use now. Now I get quite a few questions on doctor pens because they have so many different models. Personally, I have the M8, the A6S, and now the M8S. And many of you want to know which of the three should I buy. Like I said, they have quite a few different models. So those three are just a few of the ones they have. But out of the three I have, many of you ask me, which one should I get? So let's briefly cover the differences. So the M8S is the newest that I personally have, the newest doctor pen I personally have. What I love about this one is that it can be charged with a USB charger. For me, that is priceless, especially right now being on this trip we are on. I talked about this in my last video. I have so many things that need to be charged. My watch, my Oura Ring, my phone, my computer, my Kindle. I have so many cables, it is driving me nuts. My zip, my mask, all of that. So being able to charge this with a USB charger to me is priceless. Aside from that, the M8S has 6 different speeds and up to 16,000 RPMs. They did upgrade their cartridges and they now come with a backflow prevention system. And the cartridges available for the M8S are, let me take a look, 12 pin, 18 pin, 24 pin, 36 pin, 42 pin, and 3 different nano cartridges. And I just talked to my contact at Dr. Penn and I asked them why 18 pin, because the M8 had a 16 pin cartridge. And he told me, and I have the 18 pin right here, I believe. He told me that the needles are now thinner and sharper. And I have to say, I've only used this little guy once. The 18 pin cartridge felt like when I used to use the Derminator, I used a 12 pin cartridge. The 18 pin cartridge felt like a 12 pin cartridge I used before. So these needles are definitely sharper and thinner and they penetrate really nicely. So that is the M8S. Now I don't have my A6S nor my M8 with me. I just packed this one. But let's take a look at the differences. So the A6S also has 6 speeds and between 16,000 and 18,000 RPMs. So slightly higher RPMs than the M8S. As far as cartridges used with the A6S, there are 16 pin, 36 pin, and nano cartridges. The A6S, and I wish I had it to show you, but one difference with the A6S is that it has 2 different batteries. Now, if you use it in a home setting, I don't think that matters. But if you use it in a professional setting, then having 2 different batteries might be nice in case one of your batteries runs out during treatment. But it can also be used plugged in or not plugged in. And then the M8, again, has 6 speeds and between 8,000 and 15,000 RPMs. And it also comes with 16 pin, 36 pin, and nano cartridges. The M8 can also be used plugged in or not plugged in. However, both the A6S and the M8 have different chargers, so they cannot be charged with a USB charger like this one. And the chargers, I believe, don't fit, so the M8 won't fit the A6S and the other way around. Also, cartridges are individual to the pens. So this right here is an M8S cartridge. It will only fit my M8S. It will not fit my M8 nor the A6S. So that's a bit of a bummer. So whatever pen you have to get specific cartridges for that particular pen. So really between the 3 pens I personally have, there aren't that many differences. The A6S has slightly higher RPMs and 2 different batteries. I don't think that really matters if you just use it at home. The M8S can be charged with a USB charger. The M8 cannot. And the M8S has a bigger variety of cartridges. So if you ask me right now which one of the 3 should you buy, they are all fantastic. All of them do the same thing, right? And they pierce tiny little holes into our skin. So they all do the same thing. And as far as performance, I feel they are quite similar. However, would I have to choose right now between the 3? I would go with the M8S because, again, I do love that I can use a USB cable and I like the updated cartridges. I really do feel, even though this right here is an 18 pin cartridge, and theoretically I should feel this less than a 16 pin cartridge, I do feel definitely that they have updated the needles, that they are thinner and sharper, and that they are penetrating deeper, or I don't know, deeper. They penetrate as deeply as I said it on the pen, but they penetrate better because they're a bit thinner and sharper. So was I to choose right now, I would go with the M8S. However, I've only tried those 3 different models, and like I said, there are a bunch of different ones. So if you have a Dr. pen, let us know down below what your favorite model is. I know that the M8 is sort of a bestseller and that it is quite popular, but personally I like the M8S a bit better because of those upgrades. So I hope that is helpful. Now let's briefly talk about cosmetic needling. So we covered medical microneedling. Hopefully I answered all of your questions. If you have any more, please leave them down below. But cosmetic needling, in cosmetic needling we use a needle length of 0.2 millimeters to 0.3 millimeters. At that needle length, again of course we pierce the stratum corneum, the outer layer of our skin, but we only barely enter into the epidermis. So we don't create a controlled injury. Therefore, cosmetic needling can be done first of all more frequently than medical microneedling. It doesn't really induce collagen, though some experts do say if done regularly it does. But again, collagen and elastin fibers are found in the dermis, so I'm not sure if it actually does induce collagen. But cosmetic needling, in my opinion, is great for product penetration. So those needles, again, they enter into the epidermis, barely into the epidermis, and what that does, it allows for product to penetrate deeper. So cosmetic needling can be done more frequently than medical microneedling because we don't have to heal this controlled injury. I personally cosmetic needle once a week. I haven't in a while, to be honest, because I am on this trip. But in my normal setting, I cosmetic needle once a week. So the way I like to do it is I like to cosmetic needle on a Friday evening, just so I remember. So I cosmetic needle for 3 weeks in a row, every Friday. On the 4th Friday, ideally, I then medical microneedle. Sometimes it will be the 5th or 6th Friday, but I think you understand where I'm going with this. So cosmetic needling can be done more frequently. And because we don't enter into the dermis, we don't have to be so careful about what we apply before, during, and after. Now, we still want to make sure that our skin is clean. I don't want to cosmetic needle sunscreen into my skin, right? That wouldn't be beneficial, or sweat or dirt and grime. So I still want to make sure my skin is clean, but I can actually, after I cleansed my skin, apply a serum before I cosmetic needle. Now again, cosmetic needling, I personally use a stamping technique. In fact, for the past few months, I just used a doctor's stamp because it made life a bit easier. But regardless, I use a stamping technique. If you cosmetic needle, doing tiny little circles, again, you need something for slide. Though this time, you don't have to be so careful. You could use high molecular weight hyaluronic acid. You could use a growth factor serum, a peptide serum, any or almost any serum you would like to penetrate a bit deeper. Personally, I wouldn't cosmetic needle with an alpha hydroxy acid, for example, but you could use almost any serum that you would like to penetrate a bit deeper, even vitamin C. So vitamin C in medical microneedling is a known. There are some studies, small studies, but regardless, that show that when vitamin C is medical microneedled into the skin, it can actually cause granulomas. So vitamin C is a no for medical microneedling, but for cosmetic needling, you could use vitamin C if you wanted to. So cosmetic needling, we don't have to be so careful. We can use just about anything. We would like to penetrate a bit deeper, and it can be done more frequently. So on cosmetic needling, I don't get as many questions because it is a lot simpler. Afterwards, also, you don't have to be so careful. Yes, you do create tiny little channels, but since we don't go very deep, they close up fairly quickly. And really, we do cosmetic needle for product penetration. So afterwards, I would want to apply something. Again, I want to penetrate a bit deeper, like growth factors, peptides, vitamin C, whatever it is you would like to penetrate a bit deeper. So I think I answered all of your questions. Let me double check just to make sure. I think I got them all. But if you have any more questions, please don't hesitate. Ask them down below. Now, really briefly, we did talk about which cartridges to use for medical microneedling. So again, for medical microneedling, I personally like to choose a cartridge with fewer pins or fewer needles for deeper penetration. So the M8S gives me a choice of 12 or 18 pin. It does come with an 18 pin, and that is what I used when I used this for medical microneedling, the one time I used it, and it seemed quite sufficient. However, I will try the 12 pin and keep you posted. But for cosmetic needling, it gives me a choice between 24 pin, 36 pin, and 42 pin. Personally, I haven't tried the new pins. Again, they supposedly updated the pins or the needles and made them thinner and sharper. So I haven't tried them for cosmetic needling. But right now I would say I would choose a 36 pin cartridge for cosmetic needling. And when I use the M8 and the A6S, that's all that is available for cosmetic needling, and that is what I used. So medical microneedling, fewer needles and deeper penetration. Cosmetic needling, more needles, less penetration. Now, of course, we do determine the depth of penetration by dialing it in right here. So right here, I will dial in, let's say I want to cosmetic needle, I will dial it in anywhere between 0.2 and 0.3 millimeters. If I want to medical microneedle, I will dial it in at 0.5 millimeters or higher. So I can go to 1 millimeter, wherever I want to go. And whatever I choose here is how far the needles will jut out of the cartridge. So the depth of penetration is determined right here. However, I have actually cosmetic needled with a 16 pin cartridge before, and I was surprised how, first of all, even though I only went 0.2 millimeters, how painful it was, and how, for lack of better word, raw my skin was afterwards. It almost felt like I had medical microneedled. And some of you have mentioned that before as well. So even though we do determine depth of penetration right here, I feel that the cartridges still make a difference. And personally, for cosmetic needling, I like to use a cartridge with more needles or more pins, so a 36 pin cartridge. So I hope this was helpful and I hope it made sense. Again, any more questions, please leave them down below. I would love to know, do you cosmetic needle? Do you medical microneedle? If so, what device do you use? What sort of benefits have you seen? What tips and tricks can you share with us? Share all of that down below. Thank you so much for being here, and I apologize if this video is quite long. Again, I am going to leave timestamps down below, so if you want to just jump ahead to your question. Thank you so much for being here. Until next time, bye.